Hi, my name is Sam, and I'm going to be your totally awesome nurse today. I'm going to screw shit up. That's okay. Alright, so I'm going to walk in. I'm going to shut my door back, and I'm going to provide for privacy for my patient that is in this multi-unit thing right here. Let's go provide for privacy. Come on, Bob. Provided for privacy. While I'm talking to my patient, I'm going to wash my hands and get my gloves on. I'm going to multitask here, okay? So, I've introduced myself. I'm going to ask my patient their name, and I'm going to check their name band to make sure it matches. This patient has got multiple personalities, so they have multiple bands on. This is Nurse Ann, and this is also Elaine Hobbs. So, we're only going to assess one of her personalities today. I'm going to ask questions. Told me your name already. Can you tell me your date of birth? I'm not doing this to verify my patient, but also to assess their status. Do you know where you are? Do you know why you're here today? I'm going to obtain my set of vital signs, including my pain level. I'm going to record height and weight so that I can calculate BMI. Then I'm going to explain to my patient what I'm doing. I'm just going to do an assessment, a full body assessment on you, kind of just get an overview on how you're going overall. Have my gloves
on.
Are we ready? Yes, I have my. Let's put gloves on so we can be realistic. Where's my? Okay. Had to change my gloves out. Sorry. Bear with me here. Got a little rectal juice on my gloves. Nothing worse than rectal juice in the morning.
What did you used to say? It causes anal leakage.
Anal leakage, yeah. Anal leakage. Need to change your medicines. Alright, so now I'm going to begin my assessment of the head area. The first thing I want to look for is I'm looking at the color, the shape, if there's anything abnormal going on with the head. Does it look symmetrical? This one it does. While I'm on the head, I want to assess my cranial nerve number 7, which is my facial nerve. I am going to ask my patient to open and close their eyes tight. Give me a big smile. Give me a frown. Puff your cheeks up. Push them back in. It's Powerpuff Girls. Right on. And that's going to be cranial nerve number 7. I am going to palpate my temporal arteries.
Pause.
So both. Okay. We're going to palpate the temporal arteries bilaterally. Then we want to assess cranial nerve number 5, which is, I got 5 on it, the trigeminal nerve. So we're going to ask the patient to clench the teeth, which this one doesn't really. He clenched his teeth. Open the mouth against resistance. So I'm going to open your mouth for me. And that is checking my, I got 5 on it, trigeminal nerve. You won't forget that now, watch.
Did you have something to remember that? Trigeminal, like a triangle or something? Or was that a different?
No, that's a different one.
Okay.
Okay, so while I'm also assessing the head when I'm having them clench their teeth and open it, I'm going to feel the temporomandibular joint, TMJ, to see if there's any popping or clicking. I also want to palpate my sinuses. Do you feel any pressure when I'm pushing in these areas? No, I'm great. All right. Next, I'm going to move on to my patient's eyes. Other than visually looking, do they have any redness, draining, itching? I want to assess my cranial nerves 3, 4, and 6. Cranial nerve 3, oculomotor. Cranial nerve 4, trochlear. And cranial nerve 6, abducens, because abducens, you think they got abs, they got a nice six-pack. She doesn't really have a nice six-pack, but that's what we're going to check. Six-packs aren't on the face either, by the way. But in order to do this, I'm going to do my cardinal points here. All right. Want you to follow my pen with your eyes. Don't move your head. And I'm checking for nystagmus. No, they're good. I am also looking at Perla. So, dim the lights, shine the light here. It should constrict. When it constricts over here, it should also constrict over here. And I want to see the size. 3 to 5 is normal. So my patient is Perla. What's next?
You check the mouth for Perla.
I'm gonna hang a banana bag. Give me the banana. I'm gonna put some Jevity in it. Okay, so now I'm gonna look at my patient's ears. Looking at the outer ear, do I see any drainage? Do I see any bruising, any swelling? I'm gonna use my otoscope to look at the tympanic membrane. On an adult, you wanna pull the pinna up and back.
Remember to release the pinna.
Release the pinna. So, and I wanna look and I wanna see the cone of light for my patient's eardrum. 5 o'clock on the right ear, 7 o'clock on the left ear. Left is lazy, that's why it takes longer. That's how you're gonna remember that. Stupid.
Good
I know.
one. Good one.
Alright, so then, since I'm on my patient's ears, I want to check cranial nerve number 8 because 8 is great. 8 makes you think of 80 and 80-year-olds can't hear, so you want to whisper to see if they can hear you. 8, 80, great. Okay. And then I'm going to go on the other side. What did you eat for breakfast? I had eggs for breakfast. Okay, great. My patient can pass the whisper test. Alright. While I'm still in the head area, I'm going to check my patient's nose. Always checking visual assessments, drainage, nasty boogies, whatever it is. But I want to check cranial nerve number 1, which is olfactory, because olfactory smell like poop. But to do a smell test, so you have a bottle of a scent. I'm going to use vanilla. I'm going to have the patient smell. You can close one side and have them smell. Other side, have them smell. You can use different scents. Don't use anything nasty because they might all over you, and that's gross. My patient's like, that smells like grandma's vanilla cookies. Yeah, so they passed the smell test. All right, now we're gonna move on to the mouth, and I hope that they brush their teeth because it could be nasty if they don't. But for the mouth, we want to check cranial nerve number 12. That is the hypoglossal nerve. So we want to have them stick out their tongue. And go side to side. We want to check cranial nerve number 9 because 9 is alive, and we want to have them say, ah! 9 is alive. All right, and then we're going to check cranial nerve number 10, which is the vagus nerve. Now, if they are able to have a conversation with you and talk, cranial number 10 is intact. Vagus nerve, cranial nerve number 10. 9 is alive. Ah! You're too young to even know that movie, probably. Okay, so I'm going to move down to the neck. I am going to check my patient's trachea. I'm going to pretend that they don't have this in. I don't want to do it on both sides because we could compress their airway, but I want to make sure that it's midline. Okay, then I'm going to check my cranial nerve number 11, which are my accessory nerves. So I'm going to have my patient move their head from side to side, then I'm going to have them move it up to down. And that's checking cranial nerve number 11, accessory nerves. Can you shrug your shoulders for me? And I'm pushing down as they shrug their shoulders. When they have their head turned side to side, I also want to assess their jugular vein to see if it's sticking out or whatever. All right, while I'm still on the neck, I want to check my lymph nodes. Now this one, I'm going to have to practice on a little bit.
There's not too many.
So, I want to check my pre-auricular before the ear, post-auricular behind the ear, occipital is going to be on the back, then parotid is
In front of the ear.
in front of the ear. I'll have to check with that one because to be continued. Jugular, go for the jugular. Submandibular, no, submandibular is here. Submental is here, and then the cervical chain going down. So, above the clavicle is your subclavicular. When you check the carotid arteries, you want to check those one at a time. When you are assessing your arteries, you want to auscultate with the bell so that you can hear for bruise, which sounds like a whooshing sound. All right, now I'm going to move on to the upper extremities. For the purpose of saving time, we're only going to do it on one side, but we would repeat on both sides for a full assessment. First, I want to check my patient's radial pulse. I want to check cap refill. Now, if it's a young, healthy patient, I can do cap refill on the fingers. If it's an older one, I want to check cap refill on the chest.
You're checking skin
Turgor, not cap refill.
Right.
Skin Turgor is what I'm checking. Cap refill I'm doing on the fingers. Sorry, I don't have my glasses on. All right, skin Turgor, chest if they're thin or elderly. Then I want to do range of motion. I YMCA. Okay, so my patient has full range of motions. What I'm trying to rule out is crepitus. That means is it snap, crackle, and pop?
Crepitus.
It does not snap, crackle, and pop. I want to check my patient's brachial arteries. I want to have them, can you squeeze my fingers? And I'm doing both sides because I want to see if they're symmetrical. So after I have them squeeze, I want to have them, can you push, can you pull? And I want to check my patient's drift. So I have them stand up, hold their hands out, and close their eyes, and see if they're swaying like they drank a 40. My patient did not.
Please say that in Chekhov's.
Right. Okay, so then I'm going to move on to my patient's chest. And I want to visually look to see, are the respirations even? Are they unlabored? I am going to now listen to heart sounds. And I am going to listen to first the aortic. Aortic is the right second intercostal space. Then I want to move over to the pulmonic, which is the left second intercostal space. From there I go down to Erb's point, which is the third intercostal space. Down and over just a little bit to the fourth intercostal space where I will have my tricuspid. And then to my mitral, which is going to be the point of maximum impulse. It's the apical pulse. It can be found at the mid-clavicular line on the fifth intercostal space. And that is going to be your apical pulse. All right.
Which one did you say that was? Mitral?
Mitral.
Okay.
So, I listened with the diaphragm of my stethoscope, but I can also flip it over and use the bell and listen to the same sites to listen for murmurs, but I use the bell to listen for murmurs. Now I want to listen for lung sounds, and I want to use the diaphragm. I want to start at the apex of the lungs, which is right above the clavicle, and I want to move symmetrically. So I'm listening on the right side, and then I'm going over to the left. If I move down an inch, then I listen here, I go over, same thing, it's down an inch. And I want to listen at the apex, the second intercostal space, that gives me the right upper lobe and the left upper lobe. Then I go to the fourth intercostal space, that gives me the right middle lobe and the left upper lobe. And then I go to the sixth intercostal space, and that gives me the right lower lobe, the left lower lobe, and mid-axillary. I can do these same exact locations on the back. I'm not going to sit the dummy up, but I would do those same exact locations on the back. When I'm listening on the back, you never want to listen over bone. You don't want to listen over the scapula or the spine. You want to avoid the ball of the C7. T3 in between the shoulder blades and the spine is where you will hear your right upper lobe, left upper lobe, and T3 through T10 would be your right lower lobe and your left lower lobe. All right, we're going to move on to the patient's abdomen. She got no drawers on, so this is viewer discretion advised. So I want to listen for the abdominal aorta, and I want to use the bell of my stethoscope to listen to the abdominal aorta. And it is above the umbilicus, but below her xiphoid process. So if you go in between the xiphoid process and the umbilicus, you will have the abdominal aorta. I want to listen for bowel sounds. 5 full minutes to document no bowel sounds. And I want to start with my right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. And when you assess the abdomen, you
First inspect,
which
you did, then you auscultate,
then I auscultated,
percuss,
then I'm gonna percuss, then I'm gonna palpate,
need like a cat.
and I'm palpating. Okay, I also want to listen to my artery sounds, so I am going to listen to my renal. So if you find the umbilicus, your renal arteries are down and to the side a little bit. I'm going to listen to renal arteries on both sides. And then I'm going to go to my iliac arteries. Find your iliac crest. Right? Maybe? No?
You listen to one that's right here. That's your umbilicus. Then you have your renal arteries about right here.
Your renal arteries. And then your... Is it down?
Iliac's down. Mm-hmm.
Yeah, it is down on my picture. Okay.
And then don't forget your femoral artery.
And then femoral arteries, if needed, in the groin. Okay. I'm going to cover your vajayjay up.
Thank you.
All right. I've got to fill the abdomen. If you are filling, you want to fill light, which is usually 2 centimeters. Usually the doctor performs the deep, and that's 4 to 5 centimeters. Okay. Now we're going to move on to lower extremities. When we move on to the lower extremities, we always start with our visual assessment, looking at the hair growth. Do they have hairless, shiny legs? That indicates peripheral vascular disease, or PVD. I know it sounds like an STD, but it's not. We are first going to check the popliteal pulse. So behind the knee, we're going to check the popliteal pulse. Then we are going to check over the tibia. We're going to look for edema over the tibia. We want to check the posterior tibial pulse, which is behind the ankle. We want to check the dorsalis pedis, which...
The dorsalis pedis is on top of your fetus.
On top of your foot. It's not a penis. I know it sounds like penis, but it's dorsalis pedis, not penis. I'm going to check my Capri fill of my toes. Push against me, pull against me, and then Babinski's reflex. My toes should curl down.
This is where I would check their gait and the Romberg test, and then go walk to like the visual Snellen chart.
Yeah, so, and that's, I kind of put that in on my other one. So, we also want to do, if we do a breast exam.
Oh yeah, all the way up there.
Breast exam. So, with the breast exam, I'm going to do a wedge pattern. So, I'm going to start like I'm peeling an orange in wedges. And I'm feeling. Then I'm going to twerk her nipples and see if anything comes out. No, she's good. Do it on both sides. There we go. That is my assessment. If my patient was up and walking,
Ta-da.
I would assess my patient's gait when they walked. I would use my Snellen eye chart, which it's way over there. There's my Snellen eye chart, my otoscope here, lung sounds here. Yep, that's pretty much.
Did you check the reproductive parts?
Well, not on this I didn't, but we would do that with a different set of gloves. I'm not going to touch your ass or your feet with the same set of gloves. I'm going to change that every time. If you're a male, I can still do a breast exam, but I would also want to do a prostate exam. Stick my finger up your bunghole. I like it. It's a little bit too much.
I'm sending this to Miss Lettington saying, will you grade this?
Right, yeah. Did I miss anything?
No, I think you got it. Ta-da.